Hi everyone, my name is Ericka Stafford. Excuse my voice, I do have a little bit of laryngitis, so if you're unable to hear me, I do apologize. Um, this year for my clinical placement, I have been placed in a outpatient therapy resource center, which is catering to children. So it provides different therapies to children ranging from 3 years old to 21 years old. It's completely different than my last placement. My last placement with the agency for my fundamental placement was for foster care and adoption. So, although I'm still working with kids, it's more in a mental health sense this year. So, I'm a little bit nervous. I'm excited. Um, Overall, it should be a very enlightening and encouraging and an empowering semester for me in regards to growth. So I'm really excited about that. I'm excited to see myself develop in a very professional sense in a clinical aspect. So that's something that I'm really excited to do. What I am going to be doing this year in my clinical placement is I'm going to be an outpatient therapist. So my duties as an outpatient therapist is that I will be identifying different strengths and needs for a child and family. I will also be providing individual and family therapy to clients. I'll be listening to families. I'll be asking them questions, providing them with clinical information and support. I'll also be determining the needs for the children along with supportive services that may be in the sense of evaluations, referrals, internal and external specializations and different programs they may need to enroll in, along with promoting family independence and support to the caregivers, along with managing children's mental health and mental health needs and behavioral problems. We'll also be developing crisis plans, and other professionals, I should say, not individuals, but professionals will be helping me assist these families during the development of their crisis plans. Other duties that I will have as far as responsibilities with this particular agency is that they will provide me with a caseload. I will have 8 cases to be involved with obviously supervision of my supervisor along with different mentors and co-workers along with other clinicians. I'll be completing in-person trainings and online. I will be participating in clinical and administrative supervision, which is just pretty much making sure that I'm utilizing the proper skills, which is very nerve-wracking for me in a sense that, like, I'm very hard on myself as it is now. So getting critiqued as far as growth will be a challenge for me because it's a new environment that I'm going to be exposed to. So I tend to not want to make mistakes, but I know that this is the opportunity to grow moving forward in my clinical placement. I will be also completing and updating all medical records of the client on a particular program called Anasazi. I will also be having to provide information as far as assessment and treatment plans to my supervisor for approval when working with these children and families when they are requesting for outpatient therapy. So I'll definitely be utilizing them as a resource. I will also be using external and internal communications as far as via telephone, email, and or written letter. This is just notifying the parents and the children of the services being provided, terminated, needing to complete programs. This is just documentation that I will be making sure that I am following the rules along with them completing their crisis plans properly so that they are able to complete the program with encouragement, success, and ultimately empowering them into independence and providing proper services to the children so the children can not only maintain their own behavioral problems, but the parents can also help them develop properly with the proper assistance that I will be providing them and my supervisor along with other clinicians by my side. So again, I'm excited, I'm nervous. My expectation for myself during my clinical placement is just constant growth. And hopefully I will be able to seamlessly transition from a fundamental aspect from a fundamental aspect to a clinical aspect as a social worker. So I hope everybody enjoys my video, and I hope that you guys have an amazing semester. Okay,